guys, my name is Dr. Pete Lingus. I'm a physical therapist here at Precision Movement. I'm here with Ernie, and he's an avid pickleballer. Many of you would know him. And today we're going to be talking about common injuries in pickleball. So today we're going to be focusing on the shoulder. So many of you out there who love spiking the ball, slamming the ball, probably have dealt with some kind of shoulder issue. So we're going to talk about some reasons why that happens. We're going to talk about what things you can do at home and what things a physical therapist might be able to help you with. So we'll start with, what are some common causes of shoulder issues. So with the shoulder, a lot of the times when you're hitting hard, typically most people will overuse their pectoralis major muscles and their biceps tendon muscle. So if you're having issues right here at the top of the shoulder or the front of the shoulder, a lot of the issues might be an overuse of these two muscle groups. So we're going to talk about how to treat that on the next segment. But for the most part, if you're having pain there, like I said, you might be dealing with that. Other people have issues that are more the top of the shoulder, kind of inside the joint. So if you're having issues inside the joint, that might be more of the shoulder bone that is compressing up into the socket. Again, not saying that it's damaging anything, but just your mechanics and your muscle balance might be off. So then your muscles, your deltoid muscles, might be jamming the shoulder bone into the socket. So correction for that would be actually strengthening the shoulder to balance the shoulder muscles out. So that's number 2. Number 3 cause might be if you have pain in the back of the shoulder. The cause of that might be because the muscles that are in the back here, when you're hitting hard or swinging, these muscles are the brake system. They should be slowing the momentum of your arm down. And over time, these muscles get tight and get overused as well. So if you're having pain back here, it might be related to the brake muscles back here, trying to slow your arm down. And again, we'll talk about how to address that. So in the next segment, we're going to treat Ernie's shoulder, and I'll talk about the 3 common areas of shoulder pain and how to address that from a physical therapy standpoint. We'll also talk about some tips at home that you can do for now. Of course, get evaluated by a physical therapist or a movement expert on a specific plan of care. But I'll give you guys just some basic tips on how to deal with that, okay? Like I said before, the first one, if you're having in the front of the shoulder pain, the biceps tendon right here and the pec major might be overworking. So easiest number 1 thing to do is to try to relax those muscles. If something is overused, if the muscle is getting chronically strained, you do want to bring in circulation and relaxation to the area. And things that we would do in physical therapy would be, we like using technology here at Precision Movement, so we just use this Hypervolt Plus. It's a great way to get circulation and relaxation to the muscles. So we would do this here. The biceps tendon is right in the front of the shoulder. And so we're going to hit it right here. It's probably a little bit tender right there. So this is your dominant hand, right? So you're hitting hard, swinging up, overhead, across. The biceps tendon is highly engaged in this movement. So definitely I can feel some restrictions right through here. So I'm going to try to relax this. So when you're doing this at home, whether you have one of these or as I'll show you next with a self ball release, you want to feel some soreness. That's normal. You should feel a little bit of pain, but it shouldn't be a pinching pain. It should be more of a soreness type of issue, like a hurt so good type of feeling in the biceps tendon right here. And then we're going to go a little bit more to the pec major, which is just right over here, just the outside portions of the pec major. And usually, again, I would go for about a minute, 2 minutes maximum. This, again, brings circulation and relaxation to the area. All right, perfect. So we talked about, let's say, number 2, let's say your pain is more in the joint. It's more inside right here. So what we're going to do is actually try to release the deltoid muscles that are pushing up into the joint. So that would be more on the outside, like there. It's probably a little tender again. So we're trying to release the deltoid muscles right here, which is right on the outside of the shoulder, and comes down a little bit, about a third of the shoulder down here. So we want to focus on releasing that. Yep. Perfect. Great. Okay. So then number 3, if you're dealing with more back of the shoulder pain, that, like I said before, could be the teres minor complex, the posterior cuff complex. So for that, we can have you just kind of reach across, and we're going to, again, hit the back of the shoulder. So this was the brake system of the shoulder. Like I said before, if you swing forward, something has to slow your arm down. So a lot of it has to do with the posterior cuff muscles right here. So just like here, about a minute or two, try to find and build yourself a daily release or stretching routine to target these areas. Perfect. All right, great. So in this next segment, we're going to give you guys some tips on how to do this at home if you don't have one of these. Okay, so let's say you don't have a massage gun and you don't have a device at home. You can easily use a tennis ball, a baseball, something round or something firm that you can use your body weight into the wall, and that will indirectly or directly actually try to relax those muscles, okay? All right, so the first step is, again, find that spot that's tender. Let's say you're the person that has more pain in the front. I would definitely try to attack it and relax those muscles right through here. So let's try it on Ernie's left shoulder.
Left shoulder?
Yep,
Okay.
Let's try it there. So perfect. So you're just kind of putting the ball right where the pain is, and his job is just to, just kind of put some pressure, slightly lean to the wall. Okay. And there we go. And if you feel comfortable, going in and out. Try not to do too much movement, otherwise the ball will slide out. And good. Okay. And so you want to go for about a minute, just trying your best to hit those areas right there.
I can feel it.
Yeah, feel the tension there. And again, a minute. And definitely try to do this maybe even before pickleball playing. Oh, that's okay. And then also do it afterwards as well. Want to take a break there?
Okay.
Turn the light back on. Nope. Blue first. Anyways, all right. So let's say you're more the person that has pain on the side of the shoulder right here. So let's try it now sideways, like this. And if you're afraid the ball will slide away, you can use your opposite hand to hold the ball. So he's holding the ball right there. And exactly, just try to find those tender spots. Yeah. So, so for you, when we worked on it earlier, I could definitely feel the deltoid was pretty restricted there. So you want to, again, spend a good minute just trying to release the shoulder here. The shoulder is such a flexible joint. At any point, if there's restrictions, like you're trying to drive with your parking brake on, it might create some issues in the future. So even though you don't have pain, you actually want to get an assessment and treat this yourself before it gets any worse or whatnot. And this actually indirectly will improve your power and your performance during hitting. Perfect.
Oh, man.
All right, and then the last piece, again, was the back of the shoulder. So if you're having some tightness back here and you're restricted during the overhead hit, so we're going to try now the back of the shoulder right there. Perfect. And then use your other hand just to hold the ball just in case. Perfect. So the posterior cuff, the posterior deltoid, teres minor muscle groups here. Need definitely a little release. Again, that parking brake analogy. You need to have full range of motion and full strength to control your arm. Okay. Perfect. Great. Again, another minute or so. Definitely a daily routine. Just like you brush your teeth to take care of your teeth, I would definitely recommend using these soft tissue tools to release the shoulder, especially if you're, playing quite a bit. And I know pickleballers love their pickleball, right? Ernie probably plays every day if you could try.
Yeah.
Right. Okay, so perfect. So today, again, the big topic was, hey, how do we relieve some of the shoulder pain that we're dealing with? That's just a small piece of the pie. There's actually another big aspect of strengthening the shoulder, strengthening the rotator cuff muscles, and a big piece that people tend to forget is strengthening the shoulder blade muscles. So Ernie, if you could turn around. So again, let's say he's a left-handed player. He's using his arm to just swing and swing. If he's just using this area, imagine all the workload that happens here. A full swing actually should be a little bit of the core and your back muscles. So strengthening the rotator cuff muscle may not be enough. You may also want to strengthen your shoulder blade muscles. So if you have any questions on how to do that, like I said, definitely get an evaluation by a physical therapist, a movement expert, someone that can evaluate your full body and is aware of the active lifestyle and whatnot. So, all right, guys, any questions at all, feel free to reach out to myself or Ernie. We're going to be doing many more videos directed at injuries, how to deal with it during pickleball. Today we talked about the shoulder, but next time we'll talk about maybe even ankle sprains or Achilles tendonitis or maybe plantar fasciitis or even back pain or neck pain. So any questions you guys have, feel free to reach out. We're happy to talk about it and give you some tips. But again, ultimately, it's about addressing it, being ready to do some work to release the muscles on your own daily routine, but also strengthening and also learn how to re-educate your body to move better so you're more optimized and so you have better performance as well. All right, guys, stay tuned for more videos. Thank you.